Lower body injuries can be so many areas, but what are the more common?
The more common areas, especially for females, are the knee,
Yeah.
the knee injury. And basically the biomechanics that we spoke about earlier, the valgus alignment of the knee, putting extra stress on there. There's also other studies have shown that women have increased quadriceps activation, which leads to a muscle imbalance, putting more stress on the knee. They have smaller ACLs. They have smaller intracondylar notch, and I can show a few of these things on the diagram in a little bit, but it puts more stress on that ACL.
And you just mentioned ACL, so we're going to show a 3D image of an ACL tear, and this looks pretty bad. So on a scale of 1 to 10, doctor, you can tell me how bad this is.
Well, it's not a complete rupture per the diagram, but it's close. It's a pretty bad one. So what we're looking at here is the thigh and the femur and the tibia here, and we're looking at an oblique view on the front of the patella. So what we have is the ACL, which you see torn here, and what that does is actually allow, when intact, it basically confers stability from the tibia, the shin bone, from rotating forward relative to the femur. When we have a valgus stress, a lateral blow to the knee, or a twisting injury, that can rupture the ACL. Now we have lost stability of the knee.
So when I look at that and I say, oof, poor thing, what are the symptoms that person's going to feel?
Right, so usually it's going to be a catastrophic sensation. And what we have is a pop feeling, instant pain and swelling, and a loss of stability when you try to stand and move on the knee, specifically with lateral movements or change of direction.
And that's really devastating for an athlete when that happens, because the news you hear is you're going to be out for?
Well, the surgery itself usually takes only about an hour and a half, but the recovery process, it can take up to 9 months, give or take the person.
Gosh, I don't know if this is a fair question, and I'm not trying to play favorite here, but do men recover faster than women, or is it equal?
It tends to be equal in this front. The big things are regaining range of motion, strength, stability, and then building up your endurance for the particular sport you want to get back to. So there's no real differences we see.